Hello, this is Dr. Shucharita, a rehabilitation psychologist. I have been working with neurodevelopmental disorder since quite a long time, and my area of expertise in assessment of neurodevelopmental disorders, management, and providing parental counseling. Today, I'm here to answer a few of the questions that I have received. So the first questions that has been raised by parents is, how is a rehabilitation psychologist assessment different from a clinical psychologist or a psychiatrist? So this is a very valid question. I think that often we find it difficult when we are having a mental health problem whom to approach. So psychologist, whether clinical or rehabilitation, or a psychiatrist, are all expertise in the field of mental health. So when we are seeking help, people are often confused whether I should go to a psychiatrist or to a psychologist, because both are dealing with the mental health. But their qualification, their area of expertise are different. So a psychiatrist is a medical doctor or a physician who has a specific training in the diagnosis and treatment of mental illness. They focuses on the biological aspect of mental health, and they also receive training and is able to provide medication for mental illness. Whereas a psychologist who have a postgraduate degree in psychology or a PhD in psychology are dealing with human behavior, maybe from the environmental perspective, from unconsciousness, from humanistic perspective. They are clinical psychologists and rehabilitation psychologists when they further pursue MPhil in clinical psychology or MPhil in rehabilitation psychologist. Then a psychologist become a licensed practitioner in mental health. So when I'm talking about clinical psychologists are highly skilled in diagnosis, assessment, and management of mental health disorders. They do not have any medical training, so they are not able to prescribe any medications. So how they are dealing with the mental health? They are doing it through psychotherapy, or in simple term we say it as talk therapy. So now what about the role of the rehabilitation psychologist, as a question says? So a rehabilitation psychologist is a clinical specialized in the area of mental health and disabilities. So qualified rehabilitation psychologists are expected to help assist people with a wide range of physical, sensory, and developmental disabilities, as well as to restore hope, well-being, and meaning in their life. Rehabilitation psychologists are basically concerned with ADHD, autism, ID, specific learning disability, spinal cord injuries or brain injuries. Whereas clinical psychologists deal with the vast or umbrella, I would be saying, dealing with the mental health. So this is a difference between the three mental health professionals: a psychiatrist, rehabilitation psychologist, and a clinical psychologist. So if you're having a mental health problem which is very severe, there are some neurochemical imbalances, then you need to consult a psychiatrist. If you are having general mental health problem like post-traumatic stress disorder, personality disorders, then you need to consult a clinical psychologist whose focus will be on psychotherapies. And when the concern is on developmental disabilities, sensory or physical disabilities, we need to consult a rehabilitation psychologist who will help in diagnosis, treatment, and assist individual to adapt with their disabilities as well as restore to their social functioning. Moving on to the next question, that is, can emotional regulation really be taught to an autistic child, or is it only something we try to control or manage? Yes, emotional regulation can be taught and developed as a skill rather than being controlled or managed by an adult. Emotional regulation is the ability to deal, manage with your emotional experiences in a socially acceptable and flexible way. So, whether it is a frustration over a broken toy, or it may be an anxiety during a loud birthday party, their reactions are not always proportional and we are unable to understand why they are reacting in that way. So, emotional regulation is a process of learning to understand and manage this emotion. And how we can do this? We can do this by the support of co-regulation. So now you would be saying, what do you mean by co-regulation? So co-regulation is a process where one individual will help another individual to manage emotional, behavioral, and physical responses through a shared connected interaction. We all know that our autonomous nervous systems helps us or plays a crucial role in this emotional regulation or response to emotional, guide our response in this emotion. So the co-regulation helps this parasympathetic and the sympathetic nervous system to settle down. So in this co-regulation, when a calm, trustworthy caregiver help a child with autism to navigate their intense emotion, or it may be an overwhelming sensory experiences or distress, by modeling the stability and safety. So once we practice co-regulation, we are laying down the foundation for self-regulation. So co-regulation basically involving scaffolding, sensory tools, predictable routines, and teaching the child emotional awareness. Now, if I say that when we had a very tough day, maybe at our workplace, or a child may be having a tough day at his or her school, so we are looking for a friend or any one of a family member to discuss that today I had a very tough day. So what we are looking for? We are looking for a vent out. During that time, we are not asking anyone to give us any advice. We are not liking that someone will be saying, "Ke, calm down, don't behave in that way." What we are looking for? We are looking for someone to say us, "It sounds like you have a very tough day." So that is validation. That my emotions are real and that is acceptable. When we start using this skill of validation, people with autism who might be having emotional explosions and doesn't know how to react in a very functional and safer way, they will learn how to calm themselves. Now we need to teach that. That is what co-regulations plays an important role, that we need to teach the child what it means by calm down. How we can calm down. It has to be a personalized coping skill. For me, it may be calm down like take a walk in the grass. For someone, it may be like drink a glass of water. For another person, it may be like take a deep breath. So every anxious moment, and when we are saying calm down, the calm down phase will be different for different people. So the first thing we need to do is to teach the child the calm down routine and then help them to practice it independently. This is the first thing that we need to do. Second, how we can teach? We can do it by making the child aware of how they feel, how they are feeling, and how they should communicate. I am feeling angry, I am feeling nervous, I seem to be upset. So I am trying to help the child identify the emotions. Labeling the emotion helps the child to understand what they are feeling. Use very simple language. Don't use very grave or fashionable English terms. Simple language like I am angry, I am feeling blocked. So when you are using this, they are able to understand your vocabulary. Even if they are not able to understand what frustration or anxiety means, we can use emotional charts. We can have emotional charts in our classroom, or we can have a notebook containing emojis, very commonly used emojis that we can have in our mobile also. And that emotional charts works wonder for children, because many children may be verbal but would not like to communicate during this time of overwhelming situation, or maybe non-verbal. If I give you one example how you can teach your child about labeling the emotion, like a child has been watching screen, mobile. So suddenly the child crosses his arms, show some distress on his or her face. So you might be guessing what happened, why you are getting doing this. But if you know, or if you identify the cue that he is doing it because his screen time is getting over, so you can communicate, are you getting upset because your screen time is getting over? The child might be shaking his head. So you can teach the child, when you feel like you're getting angry, you have the emojis, you have the emotional charts, so you can pick up what you're feeling during that moment. And you can use the calm down routine, that may be angry face, take a deep breath. So we are teaching the child how to respond, or how to validate your emotions, and how to respond in a adaptable and socially acceptable way. So just doing this, a potential meltdown can transform into a teachable moment. Next, we can say that there are zone of regulations, like there can be red zones. When I am angry, I will be standing in the red zone. Green zone is there when I am feeling calm, I will be in the green zone. Blue zone is tired, I am feeling tired, so I will be in the blue zone. Or yellow zone when I am getting upset. So zone of regulations, through that also we can teach the child about how to label his emotions and use the process of calm down technique. Once we are using this, we need to remember this 4 things. 1, we will teach the child the calm down technique. We will validate all the feelings of the child. We will practice this calm down routine in our day-to-day life. Then only we will be able to teach the child self-regulation. So moving on to the next question, that is, how do you balance behavior control with the child's emotional needs and dignity? One thing we need to understand is that no emotion is bad. It is how we express or manifest it. That changes the whole scenario. Children with autism often communicate their need through behavior. That may take the form of withdrawn, repetitive actions, meltdown, or screaming. Instead of immediately trying to correct the behavior, try to understand why the child is doing this. What is the underlying feeling? Is the child overwhelmed, anxious, confused, or frustrated? Rather than using the word and saying like, don't behave in this way, we can say it, I think you seem to be overwhelmed by this situation. So as I was saying, it is very important that we help the child identify the emotion, because children with autism often find it difficult to identify and label the emotion. So again, the role of co-regulation. When an adult helps the child understand and name the emotion, then it increases the emotional vocabulary. For example, we can try it like this. I think you are getting upset because the routine is changing, or the noise in the classroom is bothering you. So when we are explaining and validating their emotion and labeling how they are feeling due to the change in the routine or situation, it is also increasing their self-understanding. Validation of emotion does not mean that you will accept harmful behavior. Validation means you are separating the action from the child. The focus is on the behavior, not on the child. How it is? When we are correcting the behavior, we are saying it, if you run in the classroom, it is not safe, you might get hurt. So running is the focus here, not the child. But rather than we usually say, you are behaving very badly in the class or you are naughty. So the focus is on the child. So here we are saying it, change the focus on the behavior and not on the child. And we need to acknowledge that any behavioral challenges may be due to sensory experiences also, because many emotional reactions are connected with sensory overblaming. That may be a loud traffic noise or traffic light, unexpected touch by someone, or a crowded environment. So when you accept that yes, the noise in the classroom is making you upset, or you are wanting a quiet place because it is too much noise in the classroom. So once you acknowledge or validate the sensory experiences, you are reducing anxiety for the child. So once these emotions are consistently validated, children with autism learn that yes, their emotions are real and acceptable. This again is laying the base for self-regulation. Children won't learn like this. They will learn if a calm adult support them. Rather than being reactive, you need to understand the child. You need to build that emotional safety so that they can come and discuss their feelings with you. Again, over here, we are validating the emotion. That is, we are saying it is okay to feel angry. It is okay to be frustrated. But it is not okay to hit someone or throw some object. We can deal with this emotion in a different way. Then coming to the next part, that is dignity. So definitely it is of concern that since I'm a child with ASD or ID, I don't have my self-respect and dignity. No. Preserving dignity while correcting the behavior is very important. When you are trying to correct the behavior in a respectable, supportive and non-humiliated way, children will feel safe even when they are guided. So again here, the focus is on teaching, not on humiliating. So when we preserve the dignity, the child become emotionally safe, relationship with adult increases and trust develop. Even behavioral change can be much more effective. So we are here to guide the child. So while guiding the child, we should not humiliate the child. We should use respectful language. We should speak in a calm, neutral tone. Again, understanding that yes, you need a break, so you can take a break. The sensory overblaming might be there, so you can go to your sensory room. Give or offer choices to children with autism whenever possible. Once they lack the control of a situation, it becomes difficult for them to behave in an appropriate way. So you can provide choices that yes, you can sit quietly in the classroom, or you can go outside and take a break. So providing choice is restoring a sense of autonomy as well as dignity. Avoid this forced compliance or power struggle that yes, you have to do it because I'm your mother, I'm seeing it, so you do it. So forcing compliance through authority escalate distress. Instead, be calm, guide in a very mindful and calmful way, and give the child the time to process information, what you're saying. You do this. So give that time, what I have to do, what my mother is requesting. Don't say, I said this, I have not completed this work. You have said it once. They might require 2 times or 3 times repetition of the instructions. Respect their right to say no. If they are declining to participate in any activities or in any discussion, values their ability for saying no. Even respect their right for privacy. Do not share any personal information without their consent or openly in front of the classroom or in front of the relative. Mutual respect and reciprocities are the key to control the child's dignity and emotional need. You have to take your time to understand the world from the perspective of a child with autism. They have kept themselves in a shell, and it is our task to break that shell and make them come out of the shell and be in our world. Coming to the 4th question, that is, what realistic changes can we expect after 6 months or 1 year of rehabilitation? Now, this is a very tricky question and we do not have a straightforward answer for this, because your prognosis will depend upon the severity of the symptom, the rigorous training that the child undergoes. Also, it will depend upon the persistence and the dedication that parents continue in their intervention for the child throughout the developmental phase. At what age you are being detected or diagnosed with ASD. It may be 6 years, it may be at a very early stage. So I could say that once a child has been diagnosed at a very early stage, early intervention might control the symptoms, because autism is not curable, so the symptoms might be controlled, and it is possible that mainstreaming will be faster than children who are being diagnosed maybe in the childhood. So the questions totally depend upon grounded reality, and it does not have a very straightforward answer, but consistency in maintaining the intervention, practicing what your multidisciplinary experts are saying, an occupational therapist or a speech therapist, special educator, psychologist, even your pediatric about the gluten-free diets and other things. If you are maintaining it consistently and practicing what should be there in their routine, definitely the intervention maybe for 1 year, minimum for 1 year, will be helpful for the child. The last question of today is, what is one mindset change you wish every parent of an autistic child could make? I would be saying it, be amiable. So one, you are open to changes, adjusting to your situation, and willing to learn what will be the next for my child. It will be better for every parent and even for the growth of the child. Because you need to concern over here, as I said at the opening of my question, that co-regulation. So over here, you are an important parent, are important person. Even their mental health might also have an impact on child's mental health. So you need to be open for any kind of changes that your life might be facing when a child is being diagnosed with autism. Before, you might be working, now you want to give your time to your child, so you need to adapt. There may be lots of challenges, you may be rolling with the punches, but you are resilient back. You're coming back, yes, I have to do it, I will do it. What makes it important? That be like a clay, so that in every situation you can take that different shape and you can have a better future for yourself and for your child too. So this brings us to the end of this session. Thank you for watching. Until next time, you can check out the other videos appearing on your screen to learn more. Thank you.